When we think of health disorders and treatment, there are, of course, disorders that are culture bound, that aren't seen in some cultures but are in others. Uh, we have to ask whether the Western biomedical approach to health reflects a cultural bias, and it almost certainly does. There are other ways to define health in terms of balance, in terms of warmth and cold, and other sorts of Asian philosophical views. Are there key cultural determinants of health? Very different healthcare systems in places around the world where economics may or may not play a role. And of course, diet. We know that the role of community and of marriage is very important to health, and that may play out very differently in various places around the world. Abnormality and what may be one person's vision may be another person's hallucination, depending upon cultural perspective and points of view. Are there universal disorders? I think there are only 3 or 4 that mental health researchers consider truly universal around the world. Probably schizophrenia, depression, maybe attention deficit disorder, but that's not at all totally clear. We know, of course, that there are a number of disorders that are found only in particular cultures, and that might not even be considered a disorder in other cultures. And treatment. There's some evidence that, for example, people with schizophrenia do just as well in some rural cultures with the support of their village or their local farm people as people in Western cultures who are hospitalized and receive drug treatments and things of that sort.